So before starting the session, I would like to give a small introduction about Panchajanya. Panchajanya, the divine count of Bhagwan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in our mind, our organization will work towards establishing the importance and necessity of following and imbibing the Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality but also as a way of life. All these while walking in the path of Dharma. Hence, our motto is Shrayam Bharatiyam Arogyam Ayurvediyam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharata Rashtra, and values to all the strata of people in every corner of the world. Also, the founders, being Ayurveda aspirants, know the inside out of today's medical field, hence, they aim to make people aware of this and also try their best to solve this on the go. When one becomes a part of this organization, he or she will surely feel proud and honored while carrying out the activities. Weakness becomes strength when all are united in the process of progress, in the process of doing good for the society, and that's how environment is at Panchajanya. No one is considered superior or inferior to any, and all will get a chance to show their interest, love, and devotion towards Bharat and her rich legacy. Our main goal is to reach every individual in creating awareness of our ancient knowledge and wisdom, its efficacy in the modern era, and link with current ongoing affairs, its revival, and most importantly, bringing everyone together in working towards establishing a strong system. In order for all these to be achieved, we have set up various wings with working principles and objectives that help achieve the goals faster and easier in the coming years. They are Ahilyabai Wing, Swami Vivekananda Wing, Karnatabala Wing, Govardhana Wing, Ashwin's Wing, Narada Wing, Kautilya Wing, Vedavyasa Wing, Nalanda Wing, and Sanjaya Wing. Today we have Dr. Arya Subhash ma'am. I would like to give a small introduction about ma'am. Uh, Ma'am has completed her UG in SDM Hassan, and she has finished her PG in SDM Hassan, MD Agada Tantra. Ma'am is presently working as an assistant professor in Department of Agada Tantra in SDM Hassan since 2020. Dissertation work and analytical study on the effectiveness of Shigru Bhija Mashi in Jala Shuddhikharana. Ma'am has done oral presentation in national and international, and she also published. She has done her publications in national and international. Uh, so, a warm welcome to ma'am. You can
Thank
continue
you.
the session.
Okay. So today my topic for class is number 4, syllabus number 4, death, its medico legal aspects, then exhumation and autopsy. So there has been some glitch happened in the slide, so the slides are appearing colorless. Please bear with me. Now we'll move into the contents. So the definition, I hope the headings are visible to you. So while you hear the word called death, you have to remember one important term called thanatology. Thanatology is nothing but the branch of science which deals with the study of death. So what is basically death? Death andre, you can understand it is something which is permanent and also an irreversible cessation of three interlinked vital systems of your body, namely the nervous system, circulatory system, and the respiratory system. These three are also called tripods of your life. Don't forget, these three are called the tripods of the life. No other systems are included under this. They are also called atria motors. It means that if any one of this system is going to be shutting down, then it will invariably affect the other system too. So why do we need to know the medico-legal importance of death? Medico-legal importance is nothing but how you will be applying law in medicine. So when a person dies, how is it legally important to us? First thing is we need to declare that the person is dead. Then we will be certifying that the person is dead. Only after that we can dispose his body, either take some of his organs for transplantation purpose. One more important medico-legal importance of death is presumption of death. It is like you might have seen in movies. Some people might be going away from the home for long years, and then after many years they come back. They may not come or may be coming back. So we presume this person to be dead in the period in which he was absent in his place. Now, coming to the types of death, we have it of two types, somatic and molecular. Somatic is like, imagine you are seeing a person who is dying in front of you. So what will you do usually? You just go and touch him and see whether he is responding or not. So when somatic death, that is the first stage happens, he will be losing sensibility. He will not respond to any kind of your stimuli, except he responds to chemical, electric or thermal stimuli. And we can see there will be stoppage of all the tripod functions will be happening. Coming to the molecular or cellular level of death, it includes the death of all the individual cells of your body. So this is based on your oxygen availability. How long your cells contain oxygen reserve for it to function. Till then, your molecular death will not be happening. Next is an important portion called brain death. So you consider your brain as a whole. We can divide it into three parts: cortical brain death, brainstem death, and the whole brain death. This cortical, the first one, that is where the death of your brain is involved in your.
Ma'am, can you hear us?
Yes, there has been some problem with my internet. Suddenly everything was shut down. Just a minute.
It's okay.
Is it visible now?
Yes, ma'am, you can continue now.
Yes. So we have reached in cortical brain death. So this is where your brain is dead in the cerebral part. You might have seen in movies, the people will be lying down in a vegetative state. We call it as persistent vegetative state. He will be in an irreversible coma. You cannot bring him back. His respiratory and cardiac activity will be maintained, but not his nervous system. So they are usually called the living cadavers. Coming to the brainstem death, this is where you will be having a permanent kind of death, but your respiratory and cardiac activity will be maintained. This is at this stage which is important for us medico-legally. Why? Because if a person is brainstem dead, then only that person's organs can be taken for transplantation. So how do we diagnose it? He will not be having any brainstem reflexes. He will be in a state of deep coma, and he will not be he will not be showing any other signs of life. He will be just lying in the bed as such. Coming to the whole brain death, this is a mixture of the previous two kinds of death which we have mentioned. So what is the importance for us medico-legally? One thing is for transplantation of the organs. Second one is to discontinue, whether to decide to discontinue his life support or not. And third one is to determine the time of his death. Coming to a stage called apparent death. This one is very important. It is also called as suspended animation. It is a stage where all the vital functions of your body will be maintained in a very, very minimum pitch. For example, if you are going to check the pulse of a person, you may not be able to feel the pulse, but still, if you check on the ECG, he will be alive. So this stage may be lasting for few seconds to few hours also. It can be done at two ways: voluntarily and also involuntarily. Voluntarily, one example is the sadhus or the sannyasis are said to be able to perform this apparent death kind of stage. Involuntary is like, suppose if you were suddenly in a stage of shock, your body may not be responding to any other stimuli or maintain its important functions at a very low pitch. So this thing is also very important. Coming to the modes of death, this is also called the proximate cause of death. It is basically like how your body has died here. So it is coming under three categories: coma, asphyxia, and syncope. The first one is coma. So definitely this will be pertaining to your nervous system. Patient will be in an unconscious state. You can't try to wake him up. He will not be showing any response to stimuli. Syncope is directly related to your heart. So you will be having stoppage of the heart function and also stoppage of circulation. Asphyxia is related to your lungs. There will be lack of oxygen. Along with that, your body will not be able to eliminate the carbon dioxide that is produced in the body. So here in the mode of death, remember, we have the three vital systems of your body involved. The tripods have been involved inside this mode of death. Coming to the manner of death, this says in which manner you have died. Either you have died naturally, whether you had a natural death or not. And second one is unnatural death, whether you have died as a part of a homicide. Homicide is nothing but murder, suicide, or was it an accident? Coming to the changes after the death, this is very important practically. We all know that we will be going through physical and chemical changes after the death. So we will divide this into three: immediate changes after death, early changes, and late changes after death. Immediate changes after death is basically the stoppage of all your tripods. We will be going to see each one in detail. Early changes, you will be able to just remember this slide. These are just codes so that you will not get confused between these three. Early changes are like you will be seeing changes in the eye, skin, and then you have different kind of mortis, rigor mortis, algar mortis, liver mortis. These three are involved inside the early change. Coming to the late changes, as usual, whenever it is late change, every body putrefies. Putrefaction, adiposia, and mummification. So coming to the immediate changes after the death. First one will be stoppage of the nervous system. So it is coming in the first kind of death called somatic death. The patient will not show any response to stimuli. He will be losing the muscle reflex and the pupils will be widely dilated. So whenever you hear that somebody has dead in your hospital, the first kind of test you go to check on this patient, and these are the changes you see on him. Remember it in that way. Second one is stoppage of respiration. So you go for inspection, palpation, you won't be able to see any respiratory movements. You auscultate and see, you will not be able to see any breath sounds. So in this stage, we have some important tests that is mentioned. First one is called the feather test. You keep a feather nearby the nose of the patient. If he respires, the feather will surely fly away, right? But that is not seen. If you keep a mirror in front of the patient's nose, you will not be able to see any mist formation. One more test is there called Winslow's test. That is like you place a bowl of water over the chest of the patient. If it moves or if you see the ripples on the water, it indicates that there is respiratory movement. Third one is stoppage of circulation. You will be palpating, you won't be able to hear any pulse. Auscultation, you won't be able to hear any heart sounds. So here also we have some of the tests mentioned as diaphanous test, Magnus test, ICARDS test, pressure test, and also you check for the ECG. Basically, what you are trying to do is you check for the circulation, whether it is happening or not in all these tests. You need to remember these terms. Next, coming to early changes. From here on, the very important portion of thanatology is starting. So early change in the molecular death is going to start. So the first change you are going to see in the eye of a patient is he will not be responding to any kind of reflex. You put a torchlight over his eye, you will be able to see a fixed and dilated pupil. He might have lost the muscle tone. So you may have to put pressure on opening his eyes. It will be flaccid. The cornea, every structures inside the eye will be losing the moisture. You lose the pressure of the eye, so it looks hazy and opaque. You lose the ocular tension, so your eyeballs will be sunken inside, and the pupil also will not be responding to light. Changes in the skin. Obviously, your skin looks pale, you lose elasticity, and we have one more phenomenon called contact flattening and pallor that we will see in another slide. The first thing, very important thing, cooling of the body. This term is medically called as algar mortis. Algar means coldness, mortis is after the death. So why does our body cool after the death? Naturally, because we don't have any system or any other metabolism that is maintaining the heat of our body. So one thing is we don't have heat generation because of loss of metabolism. Another thing is we are constantly losing the body heat because of the inactivation of every heat regulation mechanism. So how do we lose the heat? As any hot object would lose a heat, we are losing by three mechanisms: conduction, convection, and radiation. So where do we record the temperature? In a living body, we can record it anywhere. We record it inside the mouth also. But in a dead body, we record the temperature in rectum and in the subhepatic region. So we'll see what all factors are affecting cooling of a dead body. Imagine yourself live. What all factors will affect cooling of your body? First thing is atmospheric temperature. If it is cold outside, naturally our body will also be feeling the cold. And if it is cold outside, our body cools faster. Same thing is applicable to dead body also. Media of disposal. There we have a thing to study called Casper's dictum. Here the W means water, A means air, and G means gray. So the ratio told us 4 is to 2 is to 1. So if the body is disposed in water, it will be cooling 4 times faster as a body which is disposed in a gray. Next is body build. If you have more of adipose tissue, your body cools slower. Age. In case of infants and children, it cools very fast. If you have much more protective clothing, then your body cools slow. If there is good air movement in the environment, then your body cools faster. Position and posture. Rather than if your body has been in a flexed posture, it would be cooling slow. But if you have fallen down with an outstretched hand, your body will be cooling fast. Next is cause of death. If there has been any microbial activity involved, for sure there will be temperature generation. And in this case, your body will be cooling slow. These are the factors that is affecting. One more important thing to see is called post-mortem caloricity. Calorie means what? Something, we'll be remembering something related to heat. So this term means usually your body cools after the death. But in case of post-mortem caloricity, you have a rise of body temperature after the death, usually for the first 2 hours. That happens when the stored glucose or the glycogen in your body is broken down. At this stage, when you are going to see, you will be finding your body temperature, the dead body's temperature will be increased. So this entirely depends on the cause of death. For example, if the patient has died any kind of violent death involving any kind of rapid muscular activity, example, he died while he was playing in the gym or something. He was under vigorous muscular activity. So the medico-legal importance are, these are all signs of death. We will be able to understand, calculate the time since death. And if the body cools faster, surely microbial activity will be very less there and it retards the process of decomposition. So this is an example of contact pallor that I have mentioned previously. You can see in these areas, the body is red. Why? Because the pooling of blood has happened in these areas. But in these areas, which has been in contact with the ground, those areas are pale. This phenomenon is called contact pallor. So now we are moving to the next section called post-mortem lividity. Lividity is nothing but the color change that occurs in your body after the death. So synonymously, these are called as livor mortis, postmortem hypostasis, viviscus, sugulation, postmortem staining. Nothing but the color change happening in your body after the death. As per definition, it is the purplish blue or reddish blue discoloration due to settling of blood by gravitational force within the dependent, dilated and toneless small veins and capillaries of rete mucosum. Don't worry by the definition. We'll see each one. So we'll see how the formation and spread of lividity is happening. So after death, what usually happens? Your body loses all the tonicity of the blood vessels. So all the blood vessels will be lax. What happens is this blood pools to the areas where you will be having more of gravitational pull. Those are called the dependent parts of your body. So your CNS function is also stopped here. Your blood vessels are remaining toneless. Blood pools up to these areas because of the gravitational pull. And when the body is remaining undisturbed, what happens after the death? If the body is lying in one particular position, undisturbed body, these blood will be pooling as small and creating small patches in areas. Finally, what happens is all these patches club together to form one huge area. That is what you have seen the color change in this previous slide. Next, coming to, so what you need to remember here is the time. The time is for complete spreading of this color, it takes about 5 to 6 hours. So how do you test for lividity? What you are doing is the same thing what you have done for the test to understand the circulation. You just press that particular area for 30 seconds and then you leave it, and then you wait for whether the blood is pooling up or not. If the blood is pooling up, that indicates that okay, the body, the lividity has not been fixed. So when does this color change? It completely changes during decomposition. So we'll see what are the causes of fixation of lividity. All this lividity, your lividity that you are going to see, it just means that suppose your body was lying in a supine position and it has stayed there for enough hours so that all your blood has settled in that area and the lividity has fixed in that area. Even if you turn the body on different directions, that lividity or the pooling will not happen in other areas. That is basically the meaning of fixation of lividity. Next one is features. So you need to remember one is this is an intravascular phenomenon and it occurs in the dependent parts of the body. That is where you have maximum gravitational pull, and the color changes from red to purple because when your blood changes from oxygenated to deoxygenated blood. So the areas of contact pallor you have seen in the previous slide, those blanched areas where you have seen it in white color, that has a phenomenon called contact pallor, and it occurs in the dependent parts, sometimes even in your internal organs also this phenomenon is possible. And whenever your body is in a constant position, then this phenomenon can be seen more. In this areas you can see blanching has happened. This is the area of contact pallor and these are the areas of postmortem lividity. Next, one more important is we have a phenomenon called glove and stock lividity. Here you can see the area where you will be wearing a glove and stockings. In this area, it is in maximum. So one more idea it will be giving you is, it gives an idea on the position of the patient during the time of death. Example is hanging. In that case, we usually see this kind of lividity. And in other areas like scar areas, you won't be able to see lividity because you lack blood vessels there. Next, coming to factors that are influencing. First one is the position. If the position of the body is fixed and undisturbed, then you will be able to see in that particular fashion as in the previous image that you have seen. If there was an excessive hemorrhage to the body, you cannot see this. Why? Because you need blood in order to form this color change. Anemic patients, you won't be able to appreciate this. Complexion, in more fair patients, you will be fair kind of body, you will be able to appreciate this more. In cold preserved body also, this fixation is delayed. The color changes that is going to be fixed is going to delay. Coming to the medico legal importance, it is a sign of death. Time since death can be estimated. We can identify the relative position of the body. And next important thing is sometimes the cause of death can also be understood. For example, in case of carbon monoxide poisoning, instead of the purple color, you will be seeing the lividity of pinkish in color. In cyanide poison, you will be seeing the lividity of cherry red color. These two are very, very important. Okay, here also, I think you are not able to see the content. So the changes in muscle, it is basically divided into three. The first one is called primary flaccidity. Second one here, what was there was rigor mortis. And third one is secondary flaccidity. We'll see each one by one. First, coming to primary relaxation or primary flaccidity. These are the changes that happens in the dead body's muscle after the death. Okay, so it begins with the state primary relaxation. It starts in the state of somatic death and not in the, that is, these changes are starting at somatic death. You always need to remember that point. So it takes about 1 to 2 hours for formation. All the voluntary and involuntary muscles will be relaxed in this stage. Your whole body, your muscles, everything will be relaxed. This is the stage when you go and lift the hand of a patient and then you drop it. The hand itself will be dropping. You won't be able to see any fixed or like a rigidity in the muscle. Here the muscles respond to mechanical, electric and chemical stimuli. Next is an important thing called rigor mortis. So this one is also called cadaveric rigidity. How do you remember this? The first RIG, you just remember it for rigidity. So rigidity of the muscles. It is a state of muscles of dead body where they become stiff with some degree of shortening that follows the period of primary flaccidity. We have just mentioned that first we have primary flaccidity, then rigor mortis, after that secondary flaccidity. So what you need to remember here is stiffening and shortening of muscle fibers is mandatory if rigor mortis is supposed to happen. So the body here you will be seeing will be in a stiff with flexion attitude. I'll show the image. This is how the body is appearing. So this will be affecting all sorts of the muscles. First, it starts in involuntary muscle and then it goes to the voluntary muscle. In case of involuntary muscles also, first muscle to be affected is heart, and involuntary, the first one to be affected is your eyelids. We have one more phenomenon related to this called March of Riger or Rule of 12. It means that it takes the rigor mortis about 12 hours to develop. Another 12 hours it will be fixed, it remains in the body, and next 12 hours it takes to pass off from the body. So this is how the appearance of rigor mortis happens. First it starts in the face, jaw and neck, then it moves to the arms, along with that it moves to the thorax, to your abdomen, pelvis, and then to the lower body. This is how your body will be fixed, your muscles will be rigid. Coming to the factors. Physic, it appear and passes off early in thin build, and if he is having a weak musculature, there is no muscle to support the rigor mortis. So this will be passing off early. In summer season, it appears and passes off early. Why? Because you will be knowing the actin myosin filament theory, right? In same way, this is affecting. Whenever you have an ATP storage, that is how, till that time is when this rigor mortis is dependent upon it. So the cause of death, whenever death is preceded by a high muscular activity, then also it appears and passes off early. Why? Because already your energy reserve has been burnt off there. Condition of the muscle before death, if the muscles was much relaxed, then this rigor mortis is set up very late. And if the energy is being exhausted, it appears and passes off early. Medico legal importance, rigor mortis is a sign of death. We can estimate the time since death. We have already studied about the march of rigor, the 12-hour theory. It indicates a position of the body. Sometimes it may be confused with cadaveric spasm. We will see what the differential diagnosis of this is. And you might have heard of a case when a person did not have enough money to shift his wife's body from hospital to his home in an ambulance. So what he did is he just tied the lady's body on a bicycle and took the body to his village. So there, what has supported is the rigor mortis. So when you are going to, we have a phenomenon called breaking of rigor mortis. Suppose you have to fit an already rigid body inside a coffin. You will be just breaking the muscles there in order to handle it easily. And once you have broken it, the body does not go into the stage of rigor mortis again. It is not functionally related with the nervous system. It is only entirely dependent on your muscle and its energy reserve. So differential diagnosis, the first one is very important. Cadaveric spasm, heat stiffening, cold stiffening, and gas stiffening. Cadaveric spasm is a phenomenon. Here you will understand it with an image. This you can see, this is a body retrieved from drowning. Okay, here you can see the person's hand is containing all sorts of weed, grass, everything. So he was alive when he was thrown into the water. This is what it indicates. So this phenomenon that has happened here is called cadaveric spasm. Here also you can see this gun is being fixed in his hand. These two are examples of cadaveric spasm. These are called instantaneous rigor or cataleptic rigidity. It is a rare condition, usually happens in cases of violent death. So we can define it as it is a state where muscle or group of muscles, instead of going under primary relaxation after death, go into a sudden state of stiffening. So you don't have the first thing of primary relaxation happening in case of cadaveric spasm. As we are told, it is associated with violent death. Examples are in drowning, the weed will be grasped in the hand. In case of shooting, the firearm will be firmly grasped in the hand. Okay. Now, after this stage, it continues with the rigor mortis. That is, first cadaveric spasm happens, then the stage of rigor mortis comes, and once the secondary relaxation comes, it will be disappearing. Medico-legal importance is, if this cadaveric spasm was present, like in the previous image that you have seen, it indicates that the person was alive at the time of that instantaneous rigor. He was either forcefully dead or he might have suicided. We'll be getting that kind of an idea. So if weeds, mud, etc. are retrieved from his hand, it gives an idea of ante-mortem drowning. If any foreign object is there, we can relate it to the crime, as the case of the gun in the hand of the person. Coming to heat stiffening, it is nothing but you are just heating the body. What happens? You are just buying some non-veg and cooking it. What happens? Same thing is called heat stiffening. Your body will be subjected to say more than 65 degrees Celsius. It undergoes rigidity because of coagulation of muscle protein. Same thing happens in your while you are cooking. Same thing is called. This is an example of heat stiffening. Gas stiffening is a phenomenon. When your body is going into decomposition, there will be gas liberation. We'll be seeing that in detail during studying decomposition. And because of that, your body completely looks stiff. This both may be confused with that of rigor mortis. Next is cold stiffening. What happens whenever you are subjected to any cold? The whole body fluids will be solidified. Same thing that happens inside your refrigerator. Okay, so that also may be confused with that of rigor mortis. Yeah, stiffening, I've already told. Coming to secondary relaxation of muscles. So this is the stage following rigor mortis. So what happens is changes by the alkaline medium. When the putrefaction starts, when your body starts to decompose, this stage is escaped. Like your body finishes after secondary relaxation. This stops when your body starts to putrefy. Muscles here after the rigor mortis, it becomes soft and flaccid, and there will not be any response to mechanical, chemical, and electric stimuli because there is complete death has happened. Molecular death has started there. Next, coming to the late changes after death, the first one is called decomposition. What is decomposition? Basically, disintegration of body tissues after the death. So the late changes after death can be divided into two: decomposition and modified decomposition. In modified decomposition, we have two: adipose shear and mummification. In decomposition also, we have putrefaction. This is by the action of bacteria, remember. And here this is autolysis. Auto means self, destruction of self. That is by the enzymes present in your body. After both these processes, there will be only skeleton that is remaining. And this skeleton either it completely dissolutes or is converted as a fossil. These are the different categories and stages of decomposition: early decomposition, advanced decomposition, partial skeletonization, and complete skeletonization. This is an example of early decomposition. Here we can see advanced decompositions. This is partial skeletonization. Why? Because you can still see soft tissues are being attached to the body. Complete skeleton you might have seen in the anatomy department of your colleges. Now we will see what the mechanism is. Tissue components will be leaking and breaking up, and it releases hydrolytic enzymes. There, the bacteria will be acting. So in autolysis, the process of self-destruction of the body happens because of the enzymes that come out of the tissues. In putrefaction, you have microorganisms acting. One more variety is there. Suppose if the body was just disposed in an open area, then various animals can come and attack inside. This is also included under decomposition. Coming to autolysis in detail. So what happens is you have a decreased oxygen level after the death. Once your oxygen is decreased, it decreases the intracellular pH also. That is, your body becomes acidic. So what happens is, this one is a temperature dependent process. So your body slowly the acid dissolutes your body. We can see this process as the first thing is your skin will be slipping from your body, as in this image. The skin has been slipped from this body. The hairs will be loosened, nails will be loosened. You will be able to see microscopic changes also of progressive decomposition. Internally, what happens is, in autolysis, imagine your body is being dipped inside an acidic something, or it is covered by an acid or something. Everything inside your body will be changes into a dewy consistency, like how you knead the dough to make a chapati, in same way it changes, or like a dosa batter, it changes. And your blood vessels internal will be completely stained. You can see features like gastromalacia and esophagomalacia. It is nothing but rupture of these particular organs of your body. One more important thing while studying about autolysis is a phenomenon called maceration. I'll show an image. Here, in this baby's case, you can see the skin slippage has been happening, and inside the womb, it is completely a covered, safe, packed environment. You don't have a chance of bacterial activity there. So there you will be seeing a process called maceration. That is the autolysis happening inside a mother's womb. Next, coming to putrefaction. Always remember that whenever you hear the term called putrefaction, we have relation to bacteria acting there. And the first ones are the names of whatever possible bacteria can act on your body. So as these bacteria go on eating on your body, we will be having different production of gases. And that is the reason for that foul smell that comes out of the body during putrefaction. And physically, your body will be completely bloated. All the cavities, everything inside will be covered with gases, and they will be bloated. You have a phenomenon of a greenish color happening inside your body. That is because of the production of hemoglobin. Hemoglobin. So basically, we have three main changes happening in your body. Imagine inside your room, you have a banana you kept unnoticed for say like a period of 5 days. What all changes will you see on the sixth day? You notice there is change in color. There has been liberation of gases for sure. Like you have been experiencing some foul smell, and then liquefaction of the tissues. The whole thing changes into a thick semi-fluid matter. Now we will see what are the factors affecting decomposition. External factors, whatever comes outside the body, the first thing is temperature. You need an optimum temperature like 21 to 43 degree for a proper decomposition to happen. Moisture, if the organs contain moisture, for example, liver contains much more moisture and they will be putrefied faster. If you have more of the air, we have chance of drying up because of evaporation. So that diminishes decomposition. Manner of burial. So if the body is kept inside a shallow grave, then it decomposes faster. Now coming to the internal factors, in case of age, in children, they decompose their body very rapid. Why? Because they are very delicate, it putrefies very fast. Female bodies decompose faster. There also the delicateness comes into role. And especially if it is in a postpartum body, also the body will be very delicate. All the organs, everything will be moisture filled and soft. So it decomposes faster. Condition of the body, in fat and flabby body, it decomposes faster. Depending on the cause of death, if there was any bacterial activity involved, surely it decomposes faster. And in case of scars, the rate is being retarded. You will be having slower decomposition. Now coming to the changes of decomposition, first external change you are going to see is the greenish discoloration because of the production of sulfur combining with the hemoglobin we have seen earlier. You will be able to see multiple blisters. There will be air-filled pockets inside your body, and we have a phenomenon called marbling of skin. Here you can see there are some features happened on the body of this hand of this dead body, which is similar to the design what you are seeing in this marble. So this is called as marbling of skin. And also after the death, during decomposition, what happens is hemoglobin will be exudated from your gums. So your teeth, everything will be appearing pinkish in color. Coming to the internal changes, all your organs will be definitely putrefied. So the softer ones putrefy first, next the firmer, and finally the hard tissues will be decomposing. Now different changes are told. Brain will be discolored and liquefied. Stomach and intestine will be changing into macerated and pulpy. Liver will be having honeycomb appearance. Remember this thing, honeycomb appearance is important. Heart changes into a flabby, pliable mass. Pliable mass, Andra, it's like something of dewy consistency. You can just, it's like you are playing with a water balloon kind. Lungs will be soggy. Urinary bladder is resistant. Remember this. Prostate and uterus are the last organs to undergo putrefaction. We have one more phenomenon called colliquative putrefaction. It means that your internal organs will be burst open and then it putrefies your whole body. So medico legal importance is it is a sign of death. Time since death can be estimated, and once your body starts to putrefy, it will be difficult to identify the body, and in advanced decomposition it will be difficult to identify the cause of death also. Next, coming to skeletonization. Basically it is removal of tissues from the skeleton or bones. So we have it complete and partial. The partial one image you have seen previously. Completely you have all the soft tissues removed. So bones are either converted into fossil or they dissolve in the soil. So what happens is here calcium, everything is taken away from the bone. It decalcifies and dissolutes. You need to remember terms like this. Next feature is called adipocere. Adipocere is also called as saponification or grave wax. It is similar to you are taking bath with a soap, and after the bath you keep the soap in the holder. How does it appear? Same kind of one coating you will be able to see over the dead body. So it is a modified form of decomposition characterized by formation of a soft waxy material in the dead body. Adipo means fat and cere means wax. It looks like a mixture of fat and wax. So we'll go into the features of it. When it is freshly formed, it is hard, moist, whitish and translucent. When you see the next image, you will be able to remember it well. It is an inflammable thing because it is basically fat, and it burns with faint yellow flame. This is what you can see over the dead body. You have a like watery, rubbery, soapy kind of covering on this body. So when you go to put this, you take a piece of it and you put on the water, it floats in water. You need to remember these points, features of adiposia. It floats in water while it dissolves in alcohol and ether. It has a rancid smell. Gram-positive bacteria are able to degrade it, okay. And after some time, if you are leaving it, it turns into brittle, cracked and chalky kind of appearance. Time is like up to 3 weeks it takes for the body to form it and completely then disintegrate. All the features of the body, the wound, everything will be preserved in this case. So it helps us to understand or identify the person. So how the mechanism is basically hydrolysis and hydrogenation of fat in the body is causing your body to produce saturated fatty acid, which later changes into adiposia. So the factors that we require are, first, the atmosphere should be humid. There should be wetness. An ambient temperature of about 21 to 45 degrees Celsius should be there. You should have a moisture. Only then it will be forming that waxy. Hydrolysis and hydrogenation is only possible then. Air movement should be very minimal or retarded. A place and media of disposal. In warm water, if the body is disposed, it will be producing much more, very good, like much better it will be producing. Clothing, it can accelerate. Why? Because clothing only, the water will be locked for some more time, so it will be a supporting factor. And inside a coffin, it retards, because you don't have all these above said factors inside a coffin. You have a controlled temperature there, you don't have much moisture content there, so it will be retarded. Medico legal importance, it is surely a sign of death. Time since death can be estimated. Identification is possible, because we told all the features are preserved here. Injuries are also identified. Place of disposal can be known. You can identify whether there has been some moisture related in the area where the body has been disposed. Next, coming to mummification. I'm sure everybody might have seen Mummy Returns movie. What you see there is exactly happening in mummification. It is a modified form of decomposition characterized by drying desiccations of tissues under the conditions of high environmental temperature, low humidity, and good ventilation. So basically, the area should be completely dry, in which the body tissues are converted into dark, hard, and shriveled appearance. So this is an image of a mummy. Here the features, body features are preserved. Cells are being dehydrated here. Skin becomes dry, brownish black, and parchment kind of appearance. It's like dry kind of appearance basically. Fingers, toes, everything will be dry, hard, and shriveled. And sometimes, as the skin is being, stretched to a maximum limit, you may be seeing the splitting of skin also in all the major flexures. So you may confuse it to any other injury. Subcutaneous fat is completely liquefied, and the internal organs, everything shrink and reduce in size. So here also the time period is for peripheral. It starts from the periphery and then to the central portion of the body. It starts from about 2 to 3 days and it continues till about 3 months. It is completed. Mechanism is like body loses fluid to the environment due to evaporation, and the absence of moisture, hot temperature. Because of these 2 points, bacteria cannot proliferate. So your body has not putrefied here, but it has just evaporated the whole water contents and then turned into a mummy. Coming to the factors, size of the body is really a matter. So if it is a small sized body, it appears faster or the process completes faster. The atmospheric condition should be hot and dry. There should be free air movement. And the place of disposal is a matter. It should be devoid of water content. And medico legal importance, it is a sign of death. Time since death can be estimated. Identification is possible because all the features are preserved there. Place of disposal can be understood. Cause of death also, up to an extent. If it was because of an injury or a trauma, then it can be understood. So there ends the portion called Thanatology, or death and its medico legal importance. Now coming to another important portion called medico legal autopsy. Everybody might be familiar with this term called autopsy. It is nothing but the common post-mortem examination, what we are saying. So it is synonymously called as necropsy. Necros andre dead. Opis means to view. So that is how it got the term called necropsy. Autopsy. Autos means self. Opis means to view. So to see for oneself. Post-mortem, everybody know already, after the death. One more important term is there called obduction. That is also a synonym of autopsy. So what is happening here? Dissection and examination of a dead body, its organs and structures is basically what is happening in case of a postmortem. You dig inside a body, cut it open and you dig inside. So we have it of different types: medico legal or forensic autopsy, clinical autopsy or pathological, anatomical or academic, which all of you might have done during your first year BMS. Then psychological autopsy. Coming to clinical autopsy. This is done by a pathologist with the consent of a relative. And why we are doing this? It is to give a clarity in the diagnosis in order to understand what might have caused the death of this patient, to evaluate the efficacy of a treatment given for medical research purpose or for transplantation purpose. Coming to medico legal or forensic autopsy, the exact thing what you are seeing in movies. So for this, you need, this one is very important for us, medico legally. For this, you need a request from the legal authority. That is in order to find out what was the cause of death, whether if the death was a sudden one, suspicious, violent, and unnatural death. So a police should be carrying this investigation. He should not be below the rank of SI, or you need to have an order from the magistrate in order to conduct this kind of autopsy. So our objectives here is to determine the cause of death, manner of death, time since death, identify the deceased, and also to document the injuries. Same thing that you are seeing in movies. To collect the evidences, to retain the tissues as evidence. It is like in every postmortem, you don't just dissect the body and then send it for disposal. You take the important whatever you are finding, you take it and then you send it to the lab for analysis to determine the viability or live birth. So coming to anatomical or academic autopsy, the ones which you might have done, this is for study purpose. It is done by students under the supervision of an anatomist to learn the normal structure of a human body. So usually it is done on unclaimed body, or somebody might be voluntarily donating the dead body to medical colleges for students to study. Coming to psychological autopsy, this is like you recreate the scene when a patient has died and then you understand for what reason he might have died. That example is like when a person has committed suicide, you create a similar plot and then think on it like this is to know the mental status of the person at the time of death. That thing is not much important to us. Medico legal autopsy is very important. Coming to the rules for medico legal autopsy, it is always performed only under an official order. You need to have it from a police or a magistrate, and the body must first be identified the police or the relatives or the friends of the deceased. And if it is an unidentified body, you have to do the postmortem there. So you will be noting what the identification marks are. You will be taking different angle photos, fingerprints, etc. will be noted. And this will be conducted only in a mortuary. Why we are saying only in mortuary, we'll be seeing in the next portion called exhumation. And it will be done on all days of the week. There are no Sundays, there are no Saturdays in case of a mortuary. Every day is a working day. Now, the doctor has to carefully read the inquest report and he needs to assess the case sheet, accident register, everything before starting an autopsy. It is performed as soon as you are giving a request to do. You and the police is giving a request to do. Maximum it is conducted in daylight. Why? Because we have studied first only the feature of change of color in your dead body. So if we are seeing any particular color changes because of the poison, if that is under any artificial light, you won't be able to appreciate it properly. So it is maximum done in daylight. And if a body is received in the very late evening where you won't be able to do any more autopsies on that day, then you will be taking note on all the external appearances, how much the temperature is, whether there are superficial injuries, all the other things superficially will be taken, and then you can conduct it on the next day. No unauthorized person will be allowed inside the mortuary room. And you need to open all the cavities, and the procedure is going to be a thorough procedure. It's not like leniently we can do it, no. And once you have written a report, there is not supposed to be any erasure or alterations in it. Otherwise, it will be considered as there had been some alterations. So the report is not going to be the original one, and they will be considered. After autopsy, the body is handed over to police, and the postmortem report should not be issued to the party of the deceased. Now we'll see what are the contents of an autopsy report. It has basically three parts. The first one is called introductory part or preamble. Basically, your age, sex, residence, whatever you know regarding the patient, the time of examination, authority who has ordered, all the details will be mentioned. Second will be containing the examination part. Examinationally, you can have both external and internal examination findings. Third one is called the opinion or conclusion. Remember, every time any doctor can give an opinion, he cannot finally give a 100%, like he can't conclude and then say that this is the cause of death. He can just give an opinion, or his inference only can be made. So coming to the procedure, first you go for external examination. Imagine yourself being inside a mortuary now. You are seeing a dead body in front of your eyes. What you are going to see? First thing is definitely the clothes of the patient, of the deceased. You will be seeing, checking for any stains, foreign material, stab, any tear on his clothes. Then the second thing is called, you identify the person by seeing his face and other features. So either it is done by the police, relatives, or friends. And previously we told, if you are not able to identify the person, you take you take a note on the identification mark, photo, and fingerprints. All the preliminary particulars, whatever you see important, will be noted down. Height, roughly the height, weight, and the nutritional status, etc., will be like, you might have seen in newspaper advertisements on bodies, unclaimed bodies. A person of approximate this height and weight, wearing this kind of dress, their body has been found in this and this area. If anybody is knowing regarding this, please contact on this number or the police station. That details will be told. Then next portion is, you will be checking whether the rigor mortis is present or absent. You should remember, rigor mortis is nothing but rigidity of the muscles. Postmortem lividity, that is whether the color changes, where the pooling of blood and all those things has, it is fixed or unfixed. Why? Because it gives an idea on the time that has elapsed since his death. Presence of any signs of decomposition is there, whether any maggots. Maggot is nothing but small kinds of worms that will be starting to eat the decomposed body. Skin and body surface will be thoroughly checked for any kind of lesions, any disease or stains. If there is any special odor coming from the body, for example, cases of death due to drinking kerosene, or if it is an arsenic poison, you can smell, you can feel the smell of garlicky odor. Then state of natural orifice will be noted. There may be some poisons inserted to the natural orifices also, or there may be any chance of rape or something, that you can understand if you are seeing the natural orifice. Then we also need to document the injuries in a sequential manner. That is, you should start from any one end of the body. Sequentially, you should go on noting it down. External genitalia, any injuries or foreign body stains, etc., are being noted. Next important is the internal examination. There you will be going to open the body cavity wise. So we will see now what are the different kinds of incisions you are going to put on a body. Basically, we have three incisions: I-shaped, Y-shaped, and modified Y-shaped incision. I-shaped is nothing but the incision, it extends from the chin and then it goes to the pubic symphysis. And in all cases, you need to note that the umbilicus is being spared. You are not supposed to cut through the umbilicus because it is going to hamper the blood vessels. You are not going to get a proper idea of any blood vessels or any other. If you need to have a further study on the umbilicus, it won't be possible if you are going to cut it straight away. Next one is a Y-shaped incision. Here you can see it starts from the acromion process, goes below the breast, it meets at the symphysis sternum, and then it moves to the pubic symphysis. Next one is called modified Y shape, where it starts at the suprasternal notch and extends to the pubic symphysis. And from there, why this kind of an incision is done is, whenever you have to study a clear understanding of the structures of the neck, for example, in cases of death like hanging and strangulation, then this modified Y-shaped incision is being done. One more thing you have is called, but these three are the basic primary incisions. One more thing I have mentioned here is the inverted Y. Why it is called inverted Y? That image I have not got while I have searched. It is like, it starts from your symphysis pubis. Sorry, it starts from the symphysis menti, and then it goes to the area above the umbilicus, and then it goes to both the sides. It's like you open on two sides of the umbilicus. So the shape will come as an inverted Y. So why this is done is, when you have to study the structures of umbilicus in detail, then you do the inverted Y-shaped incision. Now coming to 4 different techniques in which your organs will be dissected in case of a postmortem. We have 4 methods called Virchow's method, Rokitansky's method, Letule's method, and Horn's method. So the first one is called Virchow's method. Imagine you open the body, you take individual organs as individual organs, you remove it separately from the body, and then you study. So the first thing to be opening is your cranial cavity. Next, you open the thoracic cavity. So first you open the cranium, You take the organs from there, study it, and then you open the thoracic cavity. Study the organs, then you go to cervical region, finally the abdominal cavity. And advantage of this method is that each organ can be studied in detail. But there can be one disadvantage, like sometimes while you are cutting through the organs, you can lose the interconnection or the interrelationship between the organs. So there may be the factor where the cause of death may be situated. You may be missing that. So that is the Virchow's method. Next, coming to Rokitansky's method. It means that you open the body and you study a particular organ block. You take, suppose if it is your heart you are going to study, you study the heart along with all of its arteries together, and you will be studying it as a block, and if needed you will be removing the organs. So advantage is that if the body has died because of any infection, you can minimize the spread of infection. Disadvantage is that the organs cannot be studied in detail. That is what is mentioned in Rokitansky. Next, coming to Letule method. This is considered as the best technique. So here what we are doing is en masse dissection. All the organs are removed as a particular mass. Together they are removed, and then each organs are separated into organ blocks. Only the related organs, respiratory system, their related organs are considered as one block. Circulatory system, their related organs are studied as one block. So this one is considered as the best technique. Because you will be able to study the interrelationship between the organ. But disadvantages is once you take it out, the organs are difficult to handle. So you may miss the causes which can be leading to the understanding the cause of death. Next is coming to the Ghon's method. It is like N block method. You remove the body into different blocks. You remove the body as organs as cervicothoracic is considered as one block, abdominal as one block, pelvic organs as one block, and the neuronal system is taken considered as a separate block. Advantage is that you can understand what all features are in being relation. Suppose if one whole system has been involved at the time of death, you will be able to understand what has been the pathology that was happened. Disadvantages, there you may miss the interrelationship. If the disease has been extended to all the blocks, you may be missing the cause of death properly here. So this is just a summary of all these three methods. You can go through it. So there ends the topic called medico-legal autopsy. Now we are coming to the last portion called exhumation. Exhumation is basically digging out of an already cremated body from the ground. So it has come from the Latin word ex meaning out of, and humus means ground. So you dig out the body. So its definition is the lawful disinterment or digging out of a body from a grave which has already been buried. It is coming under section 176(3) of CRPC, Criminal Procedure Code. So this procedure is very rarely done in India. Why? Because in India, usually the bodies are being cremated by burning. So, and this thing is different. So suppose if a person has murdered another person, then you retrieve the body from the ground. That is not included under exhumation. Only if you are doing it legally from as per the request that you are receiving from an authority, only then it is considered as exhumation. So when this is being done, in what all cases? In both civil and criminal, any body can be dug out of the grave. Civil case, it's like accidental death claim is to be get from the body. So you need to identify it properly, or you need to prove that the person has died because of the accident. So once the issue has been solved, but you did not get a positive solution, you need to redo it again. You dig out the body from the grave. Liability of malpractice. If the patient has died because of your malpractice, you need to prove it. The first proof was not enough. Then you do this procedure again. Survivorship and inheritance claims and disputed identity. Sometimes after a mass attack or something, example, a bomb blast has happened. So many parts of bodies is what you will be grabbing from that area. And somebody has come for claiming this body. That time you have just distributed the body and they have gone and then finally buried the body. What if that person has come to meet you after some days or so? That thing is possible. You might have seen in movies. So in these kind of cases also, where we need to have a second kind of investigation, we usually go for this exhumation. That is coming under civil. Coming to the criminal case, in homicide, suspected homicide, which may be masked as a suicide, death due to criminal abortion, when you have got a solution from the what from the court, but you are not satisfied it, then you ask for a second one. The body is already buried, then also this is being exhumation can be done. Coming to the objectives for identification of the body to determine the cause of death in suspected foul plays of homicide, poisoning, etc., to recover any evidence that has been buried along with the dead body, when you need to do a second autopsy. That is, the first autopsy report, what you have got is not satisfactory, then you go for a second autopsy. So the rules are you need to have an order from district magistrate or subdivisional magistrate or executive magistrate for to take out an exhumation. It is always done under the supervision of a magistrate and in the presence of a doctor. The police officer should first identify the grave, identify the coffin, identify this is the dead body of that particular person only, and also he is also responsible for maintaining the law and order. When this procedure is happening, there will be hundreds of people coming to view this. So it is usually done at early morning hours. Then what happens after you have taken the body? It is shifted to a close by mortuary where you are doing all the other methods. Whatever material is available that you have retrieved from the grave, with that you do the next post-mortem. So if the grave is like water clogged, if the body is retrieved from an area which was water clogged, you need to collect the water sample also. Why? Because you get an idea of what all kinds of reactions might have happened in the body. Coming to identification, first procedure, identification and opening the grave. The identification is done. The grave is very carefully dug out by avoiding any damages to the coffins and its contents. That time, another person will be making note about the condition of the soil, water content, how is the kind of what all kinds of plants, animals, or insects was being seen in that area. And in case of mineral poisoning, about 500 gram of the earth, the soil itself needs to be collected, which was in contact with the coffin. And we need to collect also control samples from in and around the area of burial. That also needs to be taken. Why this is? Because later we need to identify whether all these have been, whether the body has been disposed in one area and then it was brought to another area. Some foul place has happened also. For this, it is usually done. Coming to the examination, you will be removing, after removal of the whole dirt from the corpse, whatever content is remaining, that will be photographed. Then a drawing of the body and the grave is being done. You need to check the images in Google. Why? Because while I checked it, there were multiple images which one of the image cannot be used to identify or like explain the whole content that is there. So you can Google it later to identify how this thing actually works, how a report of this looks like. And if the body is putrefied, you don't have any other thing to identify. At least you try to determine the sex, stature, and identification marks, maximum what you can get. No disinfectant should be sprinkled over the body. Why? Because it will be negatively affecting the bacterial action. It gives you a negative report. And if the body is not in an advanced stage of decomposition, the body is transferred into a plastic sheet and then it is shifted into a nearby mortuary. If advanced skeletonization has happened, you need to dig and also take like maximum possible bones, what you can collect, parts of skeleton, what you can collect is taken along with the earth and nearby contents from the grave. The soil is also screened for, you might have seen in movies, they are like literally seeding that soil in order to retrieve some teeth, bullet, cartilage, all these kind of things also needs to be preserved. If needed, X-ray examination of the body will be done along with the surroundings before shifting the body. And any samples like the hair will be preserved in a clean, dry glass container. And any recent or old fractures or injuries needs to be noted down, which may be caused before the death or after the death. You need to examine all cavities and collect as much viscera as possible, and these are sent for chemical analysis. And in suspected mineral poisoning, every time the best sample to collect is the hair, nails, and long bones. Every sample you take out is duly, correctly, properly labeled along with the identity of the person, the date, everything is being labeled, and then it is sent to FSL, Forensic Science Laboratory, for further investigation. If the viscera of the person is not identifiable, suppose if his heart, lungs, nothing is being distinguishedly identifiable, then whatever mass you are obtaining from that area of the organ is sent to analysis and it is preserved. If the viscera or mass itself is absent, only whatever is remaining is the teeth and bones, then that also needs to be sent for analysis. So the last one, time limit for exhumation. It means that after the death of the person, up till what time an exhumation, the digging out of body, can be done. In India and in England, there is no time limit. After 30 years, after 20 years of death, no. You can perform it till how many years after the death. Once somebody comes and takes the case for the second or the third time, you can continue this procedure. In France, it is said to be of 10 years. Scotland, maximum is 20 years. And Germany, after the death, for 30 years, you can do exhumation. So that was the last slide. I hope you have understood the contents. Now we have ended the fourth point of death, medico legal autopsy and exhumation. Thank you.
Thank you so much, ma'am. In this busy schedule, you have accepted our request and made this session wonderful. Thank you so
Thank you.
much, ma'am.
Thank
In
you,
this crucial
Panchajanya, for giving me an opportunity. Thank you, all the coordinators.
Thank you so much, ma'am.
Thank you.
It will be helpful for so many students in this crucial period of during exams. Thank you so much, ma'am.
Okay, thank you.
If there is any doubt, we'll forward it to you, ma'am.
Sure. It can be done.
Okay, ma'am. Thank you.
Thank you. So shall I stop the session?
Yes, ma'am. You can end the session, ma'am.